In this video, I want to briefly discuss the difference between a posterior-anterior frontal chest X-ray and an antero-posterior frontal chest X-ray. Usually, the PA technique is preferred. Reason for that is that the X-ray source is behind the patient and the belly and chest of the patient is towards the detector plate, as opposed to an AP view, which is exactly in reverse. Now, this technique gives a way more realistic view of the size of the heart, and the reason for that is that the heart is an anterior mediastinal structure, and so since it's closer to the detector plate in a PA view, the shadow of the heart is much less magnified, and so you can reliably determine the cardiothoracic ratio using a PA view. On an antero-posterior view, there is much more distance between the heart and the detector plate, and so the heart shadow will be magnified, so that a cardiothoracic ratio calculation would be inaccurate. That is not to say that an AP view is completely useless. If you have a comparable AP view, you can actually detect differences in heart size. Maybe a patient has a significant pericardial effusion, for instance, or cardiac dilatation due to other causes. So it's not to say that an AP view is completely useless with regard to interpreting the size of the heart. It's to say that the PA view is way more accurate.